Olanzapine, also known as Zyprexa Zydis, is a medication used to treat certain mental and mood conditions, such as schizophrenia and bipolar disorder. It can also be used in combination with other medications to treat depression. This medication helps to decrease hallucinations, think more clearly and positively, feel less agitated, and take a more active part in everyday life. Olanzapine belongs to a class of drugs called atypical antipsychotics and works by helping to restore the balance of certain natural substances in the brain. It is important to talk to your doctor about the risks and benefits of treatment, especially when used in teenagers. The recommended daily dosage and optimal timing of Zyprexa Zydis should be determined by a healthcare professional. Before you start taking Zyprexa Zydis, be sure to read the medication guide provided by your pharmacist. If you have any questions, ask your doctor or pharmacist. Take this medication by mouth with or without food as directed by your doctor, usually once daily. Zyprexa Zydis comes in a blister or a bottle. Do not remove the tablet from the packaging until you are ready to take it. Make sure your hands are dry before handling the tablet. If your tablet comes in a blister, peel back the foil to carefully remove the tablet. Do not push the tablet through the foil because doing so can damage the tablet. Place the tablet in your mouth right away and allow it to dissolve. After the tablet has melted, it can be swallowed with or without liquid. The dosage is based on your medical condition and response to treatment. Your doctor may direct you to start this medication at a low dose and gradually increase your dose to reduce the risk of side effects. Take this medication regularly at the same time each day to get the most benefit from it. Keep taking this medication even if you feel well. Do not stop taking this medication without consulting your doctor. Remember to tell your doctor if your condition lasts or gets worse. Common side effects of Zyprexa Zydis may include drowsiness, dizziness, lightheadedness, stomach upset, dry mouth, constipation, increased appetite, or weight gain. If any of these effects persist or worsen, notify your doctor or pharmacist. Dizziness and lightheadedness can increase the risk of falling, so rise slowly when getting up from a sitting or lying position. This medication has been prescribed to you because your doctor has determined that the benefit to you is greater than the risk of side effects. Many people using this medication do not experience serious side effects. Contact your doctor immediately if you experience any serious side effects, such as difficulty swallowing, shaking, slow heartbeat, fainting, mental/mood changes, numbness/tingling of arms/legs, yellowing eyes/skin, severe stomach/abdominal pain, trouble urinating, or interrupted breathing during sleep. Zyprexa Zydis may rarely cause an increase in blood sugar, leading to or worsening diabetes. If you experience symptoms of high blood sugar, such as increased thirst/urination, notify your doctor immediately. This medication may also cause significant weight gain and an increase in blood cholesterol or triglyceride levels, especially in teenagers, which may increase the risk of developing heart disease. Discuss these risks and benefits with your doctor. In rare cases, Zyprexa Zydis may cause a condition known as tardive dyskinesia. Notify your doctor if you develop any unusual or uncontrolled movements. For females, this medication may result in unwanted breast milk, missed/stopped periods, or difficulty becoming pregnant. For males, it may result in decreased sexual ability, inability to produce sperm, or enlarged breasts. Notify your doctor if you experience any of these symptoms. Seek immediate medical help if you experience very serious side effects, such as seizures or symptoms of neuroleptic malignant syndrome, NMS, including fever, muscle stiffness/pain/weakness, severe tiredness, severe confusion, sweating, fast/irregular heartbeat, dark urine, or signs of kidney problems. While rare, a serious allergic reaction to Zyprexa Zydis is possible. Seek medical help immediately if you notice symptoms such as fever, swollen lymph nodes, rash, itching/swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so contact your doctor or pharmacist if you notice any other effects not listed above. When it comes to using Zyprexa Zydis, there are some important things to consider. For older adults with dementia, there may be a slightly increased risk of serious, possibly fatal side effects. This includes issues like stroke, heart failure, fast or irregular heartbeat, and pneumonia. It's important to note that this medication is not approved for treating dementia-related behavior problems. If you are considering using Zyprexa Zydis, it's crucial to discuss the risks and benefits with your doctor. Additionally, if you are using olanzapine in combination with other medication to treat depression, make sure to carefully read the drug information for the other medication. As always, it's essential to follow your doctor's guidance and ask any questions you may have about your treatment plan. And when it comes to taking Zyprexa Zydis, make sure to follow the prescribed dosage and take it at the optimal timing recommended by your healthcare provider. Before taking Zyprexa Zydis, make sure to inform your doctor or pharmacist about any allergies you may have. This medication may contain inactive ingredients that can cause allergic reactions or other issues. It's important to discuss your medical history with your doctor or pharmacist, especially if you have liver problems, seizures, difficulty swallowing, low white blood cell count, dementia, urinary problems, glaucoma, stomach/intestinal issues, smoking, diabetes, heart disease, high cholesterol/triglyceride levels, or breathing trouble during sleep. Zyprexa Zydis may cause dizziness or drowsiness, and alcohol or marijuana can enhance these effects. It's important to avoid driving, using machinery, or doing anything that requires alertness until you can do so safely. It's also recommended to avoid alcoholic beverages and discuss marijuana use with your doctor. Before undergoing surgery, be sure to inform your doctor or dentist about all the products you are currently using, including prescription drugs, non-prescription drugs, and herbal products. This medication may contain aspartame, so it's important to discuss with your doctor or pharmacist if you have phenylketonuria, PKU, or any other condition that requires you to limit or avoid aspartame in your diet. Zyprexa Zydis may make you sweat less, increasing your risk of heat stroke. It's important to avoid activities that may cause you to overheat, especially in hot weather. If you experience fever, mental/mood changes, headache, or dizziness, seek medical help immediately. Teenagers may be more sensitive to the side effects of this drug, especially weight gain and increased levels of cholesterol, triglycerides, and prolactin. Older adults may also be more sensitive to the side effects, such as drowsiness, constipation, trouble urinating, confusion, dizziness, and lightheadedness, which can increase the risk of falling. During pregnancy, Zyprexa Zydis should only be used when clearly needed. Babies born to mothers who have used this drug during the last 3 months of pregnancy may rarely develop symptoms including muscle stiffness, shakiness, drowsiness, feeding/breathing difficulties, or constant crying. It's important to notify the doctor if you notice any of these symptoms in your newborn. Since untreated mental/mood problems can be serious, it's important not to stop taking this medication unless directed by your doctor. If you are planning pregnancy, become pregnant, or think you may be pregnant, it's important to discuss the benefits and risks of using this medication during pregnancy with your doctor. Zyprexa Zydis can pass into breast milk and may have undesirable effects on a nursing infant. It's important to consult your doctor before breastfeeding and to notify the doctor if your baby develops any symptoms such as muscle stiffness, shakiness, unusual sleepiness, or difficulty feeding. It's important to be aware of potential drug interactions when taking Zyprexa Zydis. Certain medications can change how Zyprexa Zydis works or increase the risk of serious side effects. Make sure to keep a list of all the products you use and share it with your doctor and pharmacist. It's also crucial to inform your healthcare provider if you are taking other products that cause drowsiness, such as opioid pain relievers, alcohol, or drugs for sleep or anxiety. Always check the labels on all your medicines to see if they contain ingredients that may cause drowsiness and ask your pharmacist about using those products safely. If you suspect an overdose and notice serious symptoms like passing out or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call 911 or contact your local poison control center at 1-800-222-1222. Canadian residents can call their provincial poison control center. Symptoms of overdose may include severe drowsiness, fast or irregular heartbeat, unusual movements, or seizures. It is important not to share Zyprexa Zydis with others. Your doctor may also require you to undergo periodic lab and medical tests, such as blood sugar, weight, blood pressure, blood cholesterol/triglyceride levels, and liver function tests while taking this medication. It is crucial to attend all scheduled medical and lab appointments. Be sure to consult your doctor for more details. If you forget to take a dose of Zyprexa Zydis, take it as soon as you remember. If it's close to the time for your next dose, just skip the missed one and take the next dose at your regular scheduled time. Don't take a double dose to make up for the missed one. It's important to store Zyprexa Zydis at room temperature, away from light and moisture. Make sure to keep it in a safe place away from children and pets. When you no longer need the medication or it has expired, be sure to properly discard it. You can consult your pharmacist or local waste disposal company for guidance on how to do this. And remember, do not flush Zyprexa Zydis down the toilet or pour it into a drain unless instructed to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.